So Ben has recently suffered from a stroke from the middle cerebral artery after receiving a mitral valve replacement surgery due to infective endocarditis and mitral valve vegetation. Strokes are known to cause limb function impairment, which is one of the most common deficits that occur as a result of stroke and make it difficult to carry out activities of daily living. In Ben's case, the stroke caused the right side of his body to be severely affected. His right upper extremity is flaccid and he has highly limited use of it, and his right lower extremity is also very weak, making balance and standing on his own difficult. Ben also has some cognitive impairments and struggles with speech and communication as well. His diagnosis impacts his ability to perform his basic ADLs. When sat down to perform teeth brushing, he had trouble holding the toothpaste tube with his right upper extremity, and he also cannot stand or walk by himself due to right lower extremity weakness. Because Ben has these deficits and they interfere with his ADLs, intervention from an OT is needed in order to improve his situation and restore his capabilities. So Ben has suffered from a stroke and it affects the right side of his body. So we're going to go ahead and ask him, Ben, are you able to reach for your hairbrush here?
No, I can't.
You can't move your arm? Alright, Ben, I'm gonna go ahead and give you your toothbrush. Just try to hold it if you can, and if not, that's okay as well.
I can't.
Can't hold it?
No.
That's fine. So you have very low tone and hemiparesis due to the stroke, so that's why Ben is unable to hold everyday items like a toothbrush or hairbrush. Ben's preparatory activities consist of passive range of motion exercises and passive stretching exercises. So I chose these due to the fact that Ben is pretty much unable to move his arm on his own, and passive range of motion exercises can be used to by the therapist to move his arm around, get it used to the movements that need to be made, and kind of loosening up the joint to try to better get it ready for the interventions and the movements that are going to take place during the interventions. Passive stretching is pretty much very similar, but you have to hold the position longer and it kind of loosens up the muscles and the joints, and once again just gets the patient ready for movement and lessens the incidence of injury. I'm just going to go ahead and take your arm, bring it up here. We're just going to get you used to the movements in your shoulder and pretty much your elbows. Try some knee. And your arm, fingers as well, sorry. Passive stretching exercises. So I'm going to go ahead and take your arm. It's going to be similar to the passive range of motion, but we're going to try to hold your arm in its position just a little bit longer. So the interventions chosen for Ben are going to mostly focus on gaining functionality in his right upper extremity. The first intervention that has been chosen is mirror therapy, and that is going to be used in order to help the neurons from Ben's brain connect with the neurons for movement in his arm in order to try to restore some of that movement and get the arm to kind of get used to moving again and try to get back to normal. So this intervention is done by placing a mirror at the patient's midline, and they have to look at the mirror so that their left hand would be mirrored on the right side, and it looks as if both hands are moving, even if the unaffected side is the only one able to move. And again, this just helps restore the neurons and the connections from the brain to the arm. What we're going to do is we're going to have Ben here, go ahead and reach for these items, these various items over here with his good arm. He's going to go ahead and look into the mirror so that he can see that it's his right arm also moving, even though it's not. But it'll help the neurons in his brain connect to the movements that are going on in his arm, and it'll facilitate that reconstruction of neurons in his body. So go ahead, Ben, reach for your hairbrush. Keep an eye on the mirror. Alright, you can go ahead and reach for your toothbrush maybe. Just go ahead and get a feel for it. Alright, go ahead and reach for your plushie. Alright, Ben, good job. The second intervention that I chose for Ben is repetitive object manipulation tasks. And this intervention pretty much focuses on trying to get the patient to hold objects and either move them around or get used to holding them in their hands. And I thought this would be very helpful for Ben since he doesn't have a lot of movement in his arm. I figured that maybe getting him used to holding things would be a little bit better, and just being able to use his arm kind of as an assister, someone maybe holding his toothbrush while he has to put toothpaste on it. So this intervention mostly just focuses on getting the arm stable and trying to have it be as strong as possible to kind of hold objects and try to move them around as much as you can. So what I'm gonna do is I'm gonna go ahead and bring your right affected arm up onto the table, and we're just gonna have your toothbrush here and your hairbrush. We're gonna go ahead and just try to hold the objects in your hand and maybe move them around and like get a feel for them as much as we can. So I'm gonna go ahead and put your toothbrush in your hand. We'll just go ahead and squeeze your fingers right around that. Try to get a feel for it as much as you can. Maybe turn it like this. Right. And I'm just gonna go ahead and let go. You just try to hold it for as long as you can, okay? Okay, good job. We're gonna try a little something heavier this time, so we're gonna try your hairbrush. I'm gonna go ahead and just place it in your arm, do the same thing. Gonna squeeze your fingers around it to get a feel for that. Try to go ahead and move your hand around. Okay. Go ahead and just try to hold it by yourself, and then if it just feels hard, you can go ahead and let go, okay? We'll try something a little softer. We have a little plushie here for you. Just gonna go ahead and gonna squeeze your arm or your fingers right around that. Maybe move it to the side like this. It's a lot softer, so you can try to squeeze your fingers into it as much as we can. Right? We're gonna let you go ahead and hold it, and just hold on to it as long as you can, okay? Alright. Good job, Ben. So now we're gonna try to do what we did on your very first visit and kind of get a feel for where you're at. So I'm gonna go ahead and just place your toothbrush right here. And if you can, just go ahead and try to move your arm and grab it if you can, as close as possible, okay? Okay. I don't know if I could do it. Kind of tired? Wait, I'm gonna move it a little bit closer, and then I just want you to kind of give it your all, okay? Okay. Nice, good job, Ben. Go ahead and try to hold your toothbrush in your hand this time. I'm gonna go ahead and just put it in your hand and just kind of close your fingers around it. And I want you to go ahead and try to hold it for as long as you can, okay? Alright, I'm gonna let go. was really good.